Hello, Washington chiropractors. Why are we still wearing a mask in a healthcare setting? The WSCA staff has received no less than 2 to 3 inquiries each day asking about the mask mandate. As recently as December 7th, we, along with the American Physical Therapy Association Washington chapter, have discussed the issue with the Department of Health at length. The difference between this order and the governor's state of emergency, which ended October 31, 2022, is that the mask mandate order was issued by the Secretary of Health, which allows the order to remain in effect until the Secretary either changes the order or rescinds it altogether. Many of you have called us with detailed arguments, clinical examples, inconsistencies with CDC recommendations, and other materials that support the removal of the mask mandate, especially in a chiropractic setting. Please rest assured that we have shared all these arguments with the department, including their clinical director, Dr. Tao Kwan-Gett, Chief of Science Officer. We shared that patients aren't seeking care, that patients are arguing with other patients and staff and their providers. Patients are confused because they can go to a large, crowded sporting event screaming at the top of their lungs, but they must wear a mask in a chiropractic office. We shared that we understand in clinical settings where there's a lot of sickness and people at risk, they may need to have a different approach than outpatient settings. We shared that there could be a tiered approach and make it recommended rather than mandated, and we shared in detail the differences between our requirement and CDC recommendations. The outcome of that meeting is that they will take our recommendations into consideration. They are managing health systems that are once again overwhelmed with patients because of flu and RSV, including COVID. We responded that the media has a role in this to guide patients with appropriate information as to when they should be going to an urgent care or an emergency room, or when they should be seeing their pediatrician. We even shared the drain of resources on boards and commissions due to frivolous complaints. The department indicated they would respond within the first week of January, if not sooner. We realize that this is not what you want to hear, nor does it deliver the outcome we all seek. Please know that the WSCA has and will continue to challenge the inconsistencies in this requirement and will report to the membership the moment the policy is changed. This is not what we wanted to hear, and understand it's not what you wanted to hear either. Please know that even in difficult times, the WSCA is doing our best to help chiropractors help patients.